Hello, all, this is Dr. Dheeraj. I'm a consultant anesthesiologist and I specialize in neuroanesthesiology. And today I would like to tell you guys the scope of regional anesthesia and why you should do fellowship in that. And if you are planning to do fellowship and in India, where to do, and in abroad, what kind of fellowships are there. So these are the two separate topics I would be discussing in this particular video. So what is regional anesthesia? You all must be knowing it includes regional blocks, peripheral nerve blocks like brachial plexus block, sciatic block, and popliteal nerve block, and several blocks. And even in neuroanesthesia, there are several blocks like a scalp block, erectospinal nerve block we are doing now, and TNTS, inferior alveolar nerve block we would be doing. There are so many nerve blocks we perform. The advantage of doing this regional anesthesia is basically you can avoid general anesthesia in certain cases, and the complications that you can the complicated cases and high risk cases you can do in regional anesthesia, and it will greatly help you in freelancing and so getting a brachial block and doing a hand surgery, and so those kind of things will significantly help you in freelancing practice. And also for post-operative pain relief, even in general anesthesia, for example, if you're doing a TKR or any other surgery, if you perform a regional block for that particular limb, it will greatly help in the post-operative pain in that particular patient. So either you practice in a big hospital or you freelance, regional anesthesia will add a lot of value to your CV. Regional anesthesia is more like a skill upgradation, I feel. So I think every anesthetist should do regional anesthesia fellowship. So if you are planning to do regional anesthesia fellowship, then where should you do it? So you should visit this particular website. So you just visit this particular website called as Aurora Academy of Regional Anesthesia of India. In that they have a fellowship, and you can see here the fellowship duration is 1 year, and it's a full-time fellowship, so it's more like you will be paid a stipend during the fellowship depending upon the institute. So who is eligible for that? MD, DNB, and even diploma anesthesia is also eligible. So many NB diploma guys in my channel would be happy after seeing this. So that is one. And selection process is directly you should apply to the particular hospital, and based on the number of candidates, I think they will have a method of selecting you. Course starts in February 1st and the last date for registration is March 31st. I think maybe Feb 1st is the course duration. So, and all the rest of the details are given in this particular website. Okay, there will be an exit exam conducted by I think it will be conducted in some place where all the fellowship candidates will go there, and that's how all the fellowship exams would be there. And the trainees would repeat the exam. 10,000. Yeah. So that's it. So that is about the Indian fellowship. So where all you can do, the list is there here. Ruby Hall Clinic, Dr. Amit Dikshit. This is a very good place. You can do a fellowship in this place. Ganga Hospital, Ganga Medical Center in Coimbatore, Dr. Bala Venkat. I have done a video with him. I hope you have seen that video, and this is a very good place to do. I like that, several institutes are there. Kokilaban is good, and there's so many institutes you can do in all the Astro RV is good. Jain Hospital you can do in Bangalore. So Astro CMI in Bangalore is good. Yashoda Secunderabad is good. St. John's is good in Bangalore. So most of the fellowship programs are in Bangalore, I think. So all these hospitals are good. So it's a 1-year program, and then you don't have to practice exclusive regional anesthesia. It's not like neuro anesthesia or cardiac anesthesia. Basically, it is more like a skill upgradation. That's what. So you can do a general practice with having an extra skills, which will help you in your practice. So no, I would like to go abroad and do it. Then even then I'll show you a better one way for that. So you can just click on fellowships in UK, and so this is in Oxford University. You can apply to this program through MTA route, which I discussed in one of my videos before. So here you'll get a type 5 visa, and you need to get your GMC registration done, and the college will the college where you get your fellowship will sponsor your Tier 5 visa and GMC, and you can go and do the fellowship there. Tier 2 visa also you can get, and this is so Tier 5 visa I think is a little easy. This is about UK. Like that, many centers are there in UK where you can do the fellowship. If you plan to do in USA also, I'm going to show you there is a way. So you can, this is one of the place, Stanford Hospital, you can do regional anesthesia fellowship. So it's a 1 year fellowship, and if you have to apply here, then you need to have your ECFMG certificate. So basically ECFMG is nothing but if you will be an international medical graduate, IMG for USA. Anyone who studied apart other than USA and Canada are called IMGs. So your medical school should be registered under the World Directory of Medical Schools. If your school is, most of the medical colleges in India are there in that. So ECFMG certification, if you finish, then USML is 3 steps you have to finish, and after that you can apply for fellowship. But the only thing is that the difference between UK and USA is that in UK if you do, you might get a job at the end of it and you can continue there working in UK, but in USA it is not possible like that, because you cannot practice in USA without a residency of anesthesia in USA. So you can do the fellowship of 1 year, but you have to come back. And so if you ask me what is the use is, if you have an international exposure like USA, and later on when you apply to Middle Eastern countries for jobs or something, the value will be very high, because you would have known the kind of care, the kind of exposure to international countries. So you will be more preferred in Middle Eastern countries. So nothing is waste. So in that way, if you think, even USA is a good option for doing regional anesthesia. So that's it, guys. I think if you're planning to be in general, if you don't want to subspecialize, then go for this regional anesthesia fellowship. Thank you very much.